Well, good afternoon. We'll get started. Welcome to the fourth meeting of PPOB. And we do have a quorum. We have Madam Clerk, would you please call the roll?
Senator Berg, Senator Carroll, Senator McDaniel, Senator Mills.
Here.
Senator Neal, Senator Nemus.
Present.
Senator Wilson, Representative Bojanowski, Representative Duval,
Here.
Representative Fleming, Representative Graham,
Here.
Representative Petrie,
Here.
Representative Pratt,
Here.
Representative Tipton,
Here.
Auditor Ball,
Here.
John Hicks, Victor Maddox, Sharon Mattingly, Representative Hale,
Here.
Senator Higdon, Representative Johnson.
Here.
Thank you very much. Our first order of business this afternoon. As most of you know, that Dave Eager will be retiring, I think, effective June the 30th. And we would like to just recognize him today, even though he's not here. We might not get another opportunity to publicly say thank you, Dave, but Chairman Johnson and myself have a citation prepared to say some good things about him, the good work he's done over the last 8 years, and that we appreciate all that he's done and to bring our public pension plans back to something called normal. We've got a long way to go to be fully funded, but we're getting back to something called normal. So Dave's done a great job, and we want to recognize that. And we have a plaque. Yes, you already have it. We have a citation. It's already framed and ready to go, and we would sure appreciate, Aaron, that you all take that back to Dave. And I would ask for a motion from the committee to approve this, on behalf of the committee, approve us doing this. And we have a motion and a second. All in favor signify by saying aye.
Aye.
Opposed? Motion passes. And tell Dave that we really appreciate his work, and don't be a stranger. First order of business is KERS Nonhazardous Agency Participation. House Bill 8 reporting requirements. I guess. Okay. Before we do that, let's approve the minutes from the last meeting. We have a motion. We have a motion and a second. All in favor signify by saying aye.
Aye.
Opposed? The ayes have it. Motion carries. Okay, Aaron, if you and staff would come forward and give us your report on the House Bill 8 reporting requirements. Thank you all for being here. If you don't mind, identify yourself for the record, and the floor is yours. Please proceed.
Absolutely. Good afternoon. Thanks for having us. My name is Erin Surratt, and I am the Executive Director of the Office of Benefits at KPPA.
I'm Carrie Bass. I'm a staff attorney supervisor for the KPPA.
Before we get started, Mr. Eager sends his regrets for not being able to attend today, and I'll just say on his behalf, thanks for the recognition that you all have given him. I'm sure he'll be most touched by that. He has done great work since he has been at KPPA, so thank you very much for that. All right, well, let's get started with the reporting requirements under KRS 615991 as a result of House Bill 8. Well, There we go. Sorry about that. First of all, let's just have an overview of House Bill 8, what it is, what it did, and the reason that it was needed. So again, House Bill 8 only applies to the employer contribution rate for the KERS non-hazardous employers.
Yeah, something's happened to your microphone there. Pull it a little closer to you. Is the green light?
The green light is on. Can you
Okay.
hear me? Okay, great. The reason House Bill 8 was needed, it was needed to address the decreasing payroll that was seen due to downsizing and outsourcing and contract employment and the KERS, with the KERS non-hazardous plan. Over the 10-year period from 2008 to 2018, quasi-agencies reduced their payroll by approximately 26% during that 10-year period. During the same period, the executive branch employers reduced payroll by about 2%. So the way that the calculation works, it's the same initial calculation of the total liability and the amortization cost as it was before House Bill 8 and now. Every year, the actuary calculates how much each person's liability is in the plan to determine the total liability of plan. Then they subtract the assets, which results in the total unfunded accrued liability or UAL. Prior to House Bill 8, the actuary used projected payroll to determine the across-the-board contribution rate representing the aggregate amortization cost. That's the same as what is used in the other plans that are under KPP as well. This calculation for KERS non-hazardous is no longer based on projected payroll, and that's to eliminate the impact of an employer's decreasing payroll. So House Bill 8 requires that a fixed percentage of the UAL be assigned to each individual employer based on the total UAL of June 30th, 2019. Each employer's 2019 percentage of the liability is multiplied by the current year UAL to calculate the UAL flat dollar amount each employer must pay for that year. This is known as the actuarial accrued liability contribution, or AALC. The UAL dollar amount is determined each year based on the current year UAL, but always applies to the same percentage allocation for each individual employer. This slide just shows an example of how that amount is calculated for an individual employer. The employer monthly contribution calculation is they pay the normal cost times the payroll, the percentage amount for normal cost, plus the AALC monthly payment. So the example shows that the total 2019 liability was roughly $19.2 billion. And for this example, the employer A, their total liability amount was $2 million of that $19.2 billion, resulting in the $2 million divided by the $19.2 billion results in their percentage amount. So if you look on the graph, you can see for each fiscal year's the normal cost amount, the total amortization cost times their percentage amount gives the annual AALC divided by the 12 months gives the monthly AALC payment. So it's normal cost plus the AALC payment amount for the KERS non-hazardous employers. Now, House Bill 8 also required some additional reporting. Employers are required to report annually to KPPA all the independent contract or leased all contractor or leased employees. KPPA reports the stated to the Office of State Budget Director and the LRC. KPPA is also required to audit 5% of the employers who are required to do this additional reporting. and the 5% was set by the KERS board. This legislation introduced the concept of utilizing subsidy incentives for employees to reduce the number of contract employees that they were using. So this slide shows a list of the different groups that are required to do the additional reporting under 615991. You can see there's local health departments, community mental health centers, state universities, and any employer that is eligible to voluntarily cease participation in KERS under 61522. So here is a timeline of the reporting requirements. So by April 15th of each fiscal year, that is the deadline for the Form 6756 and any required documentation, the contracts, to be submitted to KPPA for the non-contributing employees. And I just want to note that KPPA is enhancing all of our processes. KPPA is transitioning from the submission of the paper form to an online reporting for the employers to do through their employer self-service module. Then by June 30th, there's a deadline for any new non-contributing employees between April 15th or April 16th and June 30th. The employer must report those non-contributing employees by June 30th. And then the KPPA by August 29th sends a list of the non-contributing employees to the employee for those that meet the criteria for an employee under the common laws factor applied by the IRS. Also, September 30th is the last day for KPPA to notify the employers of the determination regarding these contract employees. So here are the requirements of who has to be reported as a result of this. Any persons who are employed as an independent contractor, a leased employee, or via any other third party employed directly by the employer who qualifies as a regular full-time employee pursuant to KRS 61.510.21. Employers must submit the form along with a copy of the contract or any other documentation that explains the services for each of those persons. And there are a few exclusions to this reporting. So any contracts that were entered into prior to January 1st, 2021 are excluded. Contracts for professional services that have not historically been provided by employees of that employer, and non-core services independent contractors defined in 615991. So as I mentioned, we have to report to LRC and the Office of State Budget Director. This slide, that is due 60 days after fiscal year end. So by August 29th, that report has to be sent. And these are the required data that's required to be sent in that report. So I'd just like to provide a little bit of information as far as the compliance of the reporting by these employers and how that's gone over the past few fiscal years. In fiscal year 22, all employers, with the exception of 11, reported timely, so by the April 15th date. Because this was the first year of the reporting, we made an exception and did some additional outreach to the 11 employers to allow them to get their reports in to us, which they did. KPPA determined, with the exception of 2 agencies who are inactive in an active litigation, that's 7 counties and Kentucky River Community Care, they did not submit anything and have not submitted anything. During fiscal year 22, KPPA determined that 1,585 persons that these employers were utilizing as independent contractors should have been reported to KPPA as regular full-time employees. 9 of the 10 agencies representing 450 persons have complied and were reported as a result of that. The additional 1,135, that employer did not agree that they should have been reported, and they have not reported. In fiscal year 2023, all employers submitted their information timely. In that year, KPPA determined that 1,796 persons should have been reported, representing 4 different agencies. 3 of the 4 agencies complied, and 112 additional persons were reported. The same employer, leaving 1,684 persons, that same employer disagreed and has not reported those individuals. So for fiscal year 24, we have all of our employers have submitted the information timely, and we are in the process of reviewing that. And the report will be delivered by August 29th. That's all I had.
Okay.
Welcome any questions you may have.
Representative Tipton has a question for you.
Mr. Chair, I may have 2 or 3 if you permit.
Yes, sir.
While we're giving accolades, I just want to take a moment and thank former Representative Jim Duplessis, who was the primary sponsor of House Bill 8. I was the primary co-sponsor on this bill. It was a very challenging piece of legislation to work through. We went through a lot of spreadsheets. And one of the things that we looked at was what the projected costs would be for the different agencies. Do you all have that information? You could share with us on what the agencies are actually, what their actual cost is.
The actual dollar amount?
Yeah, after the formula has worked, what they're actually, and maybe compare that to see how they are comparing. And as a follow-up to that, are any of the agencies having difficulty making their payments in a timely manner?
And I'm glad you asked that question. We do have that information, and we can send that to you after the meeting. I'd be glad to do that. In regard to the actuarial, the AALC payments, all agents are complying with paying the monthly invoice, except for Kentucky River Community Care and Kentucky Municipal Utilities Association.
Okay.
So, and of course, the 2 that are in litigation.
Okay. Mr. Chair, if I could have a follow-up.
Yes, sir.
Now, in regard to that, in the situation on reporting, when you have agencies who dispute, and then what's the process you all are going through to resolve these disputes? And refresh my memory on House Bill 8, do you all have the authority to enforce action to require them to comply?
I'm going to let Ms. Bass take that question.
There are a couple of different options that the Kentucky Retirement Systems or the Kentucky Public Pensions Authority on its behalf can pursue regarding non-compliant employers under the 615991 process, and those options are still under review. One such option is a statutory option that existed before House Bill 8, involuntary cessation of participation in the Kentucky Employees Retirement System.
I've got one more follow-up question.
Yes, sir. Please proceed.
On the 2 entities that are in litigation, 7 counties, and was it Kentucky Rivers? I forget the exact term. How long have those been in litigation, and is there any foreseeable outcome to those situations?
Both matters are a long-standing litigation. I think 7 counties is the longer one. It's definitely in the decade marker at this point.
Okay.
Yes, particularly in 7 counties, there continue to be discussions that will hopefully result in the resolution of that matter as quickly as a 10-year litigation matter can be resolved.
Okay, thank you.
Yeah.
I have a couple questions for you while I'm waiting for somebody else to chime in. The one entity that has 1,684 employees that you say should be reported and are not, are they receiving any type of subsidy from us on to pay their contribution?
I believe they are, but I want to confirm that. I will
Well,
let you know
when
for
you
sure.
confirm that, the information that you're going to send to Representative Tipton, please share it with everyone on the
Okay.
committee if you don't mind.
I absolutely will.
But yes, that would be very good information to know. You mentioned the number of employees that you lost between 2008 and 2018, 26%. What type of increase have you seen since implementation of House Bill 8 on quasi-reporting their employees?
I'm sorry, but I don't have any specific numbers, but we definitely have seen an increase in the payroll. That could be for House Bill 8, along with just a general increase in employment that we've seen across different sectors, even the local government. We've seen an increase there. So,
On 7 counties, like I said, they've been in litigation for 10 years. Are they making any type of contributions to the retirement system as we go along?
no, not currently.
Okay. Chairman Petrie has a question.
Thank you, Mr. Chair. You had mentioned of the 2 that disputed the numbers, there were follow-up actions or compliant actions being reviewed. What were the possible compliance actions or enforcement actions you were reviewing? I missed those, I'm sorry.
There are a couple of options for the non-compliant employers in the 615991 process. I can't speak to a couple of those options as they are attorney-client privileged conversations, but I can point to a statutory option, which is involuntary cessation of the non-compliant employers under 61.522 gives the Kentucky Retirement System Board of Trustees an option to involuntarily cease an employer for any number of statutory violations or non-compliance.
May I follow up?
Yes, sir.
Is that the only statutory option given to KPPA for a non-compliant?
No.
Are there other statutory options?
There are other legal options that are grounded in statute, yes, but I am
No
unable to get into
specifically
it.
outlined statutory options, just implicit statutory options.
There are statutory obligations that the employer has to meet, and then some options that exist in other statutes outside of the Kentucky Employees Retirement Systems framework that the Kentucky Retirement Systems Board can pursue.
May I follow up?
Yes, sir.
What kind of timeline are we looking on resolution of those outstanding 2, whether by action taken or to be removed from compliance measures?
I don't have a timeline for you today. I do want to point out that if we're talking about the employer that is non-compliant with 615991, that is just one employer. They have been non-compliant in 2 cycles of this reporting.
And I think that's the one I'm talking about. So if they've been compliant for non-compliant for 2 cycles, which would be 2 calendar years, 2 fiscal years?
2 fiscal years,
Okay.
yes, that's correct.
2 fiscal years, but we don't have a timeline of when compliance actions will be taken?
No, sir.
Okay. And may I follow up?
Yes, sir. I think you're onto something.
Well, I'm going to switch gears now, unfortunately. Relative to the 2 pending litigation issues, 10 years is a long time, very long time, especially when they have obligations to pay in. Timeline for resolution?
Unfortunately, sir, I don't have a timeline for resolution on 7 counties or KRCC.
If I may.
Yes, sir.
7 counties, if I recall, may have started back in 12 or 14. Does that sound about right?
That sounds right to me, sir.
And it's 2024?
Yes.
It's a long time.
It is a long time. I do want to assure you that the Kentucky Public Pensions Authority and Kentucky Retirement System Board of Trustees takes that very seriously and working diligently to resolve that matter through the legal process.
It's a federal court case?
7 counties is. Kentucky River Community KERS is state court.
Federal court, I'll pull their docket this afternoon when I get home. and I'll see what activity's been on that docket. I'd like to have some kind of idea of what the timeline is on a resolution, if it's possible to give one, or I'll try to remember it from meeting to meeting, and I'll ask.
We'll get you a follow-up to that question to the extent that we're able to.
Very good. Thank you, Mr. Chair.
Yes, sir. Chairman Johnson.
Thank you, Mr. Chair. First, I just want to reemphasize the information that has been requested, critical. And I want to thank Chairman Petrie for those pointed questions. I think it sort of leads into the question I want to ask, and that is, based upon your perspective, looking at House Bill 8, the provisions and the process, is there anything that you guys have identified that legislatively we may want to take a look at to improve the process in the next session? And if you don't have an answer for that, I'd certainly understand if you wanted to include it in your follow-up response.
I don't have an answer for that today, sir. I will take it back to the team, and if there is something, I'll be sure to include that.
And as you consider that with the team, I would definitely consider Chairman Petrie's comments.
Absolutely.
Thank you. Thank you, Mr. Chairman.
Yes. On the subsidies, and this one that's non-compliant with 1,684 members, and they're getting a subsidy. Is there anything in the legislation that says we can suspend that if they're non-compliant?
I will note that in KERS 615991, the incentive or the subsidies and the reporting, the subsidy piece of that statute has been suspended in the last budget cycles. So really what we're doing is the reporting piece, but so far there hasn't been any action to take the reporting information and apply the subsidies as it's laid out in that statute.
Run that by me again. What was suspended in the budget?
Do you have the exact?
I've got the statutory citation, 4, 5, and 6. So there's 61, 5, and I do not have the budget.
Yes, and I'm sorry, I don't have that with me. I should have had that, but it is 615991. I believe it's subsection 6. But again, we can look that up as well.
Okay. Would you also supply to the committee the agencies and whether they're compliant or not in the subsidy that they're receiving? Could you share that information with us?
We can go through there and provide.
It would be good to see
Based on budget.
that information.
Okay.
One final question. I'll be quiet. Have we seen those subsidies? Have we seen that the amount of subsidies we're paying as of course the contribution rates have gone down? Are we seeing a reduction in the subsidy amount?
I honestly, sir, I would have to go back and look. I don't have that information available today. I did not prepare for that. I apologize, but I'll check on that as part of the information.
Thank you. Any other questions? Seeing none?
If I may,
You may.
I have one additional item that I would just like to speak about very briefly. There's been a lot of discussion and talk about across-the-board raises and how they are applied to pension spiking. There was a bill, Representative Blanton had a bill in the last session to address the Court of Appeal ruling that we saw as it relates to that issue. That bill was not passed during this last session. So we are, as an agency, KPPA, trying to work through how we are going to implement that court decision. We intend to do something within a regulation to be able to comply with the court ruling. That information, the KPPA has an ad hoc regulations committee. That regulation will go to that committee on June 5th at 10 a.m. So I'm not going to have a lot of specifics to give you today on that, but it will be released to the public then. And I will say that we will probably seek codifying that in statute once if that goes through.
Okay, one final note. hopefully you'll be working on some requests for legislation as we move forward on things that need to be changed with House Bill 8.
Okay, we will get those. I'll get that from the team and send them your way. Thank you.
Thank you all. Okay. Chairman Petrie has a question.
I'm sorry, comment if I may more than
You can
anything.
comment. It's
More than
good.
anything else, on the issue of pension spiking, the reg will help tremendously to give an idea of what the thoughts are and how best to deal with it. I would encourage you that if you're looking for statutory codification of that or some other approach to the issue, to make sure that Director Hicks is consulted on that. Myself, I've been interested and looked at it. I think the legislation may have a lot better chance of making it through if it is vetted well before we get to session.
Okay.
I think it'll have a much better chance. Not that Representative Blanton did anything wrong. He's working on it as hard as as fast as he could. But it is a complicated issue with a lot of ripple effects that we want to watch for, and we need time and space to do that so that multiple heads can analyze it, as opposed to a bill dropping and it needs to be done.
Okay.
Okay, thank
We
you.
will do that.
Chairman Petrie, thank you for those words. Thank you all for being here.
Thank you.
Appreciate it, and look forward to the information that you're going to send us. Thank you. Next up is Steve Shannon, Executive Director of Kentucky Association of Regional Programs. I think those are mental health centers, if I remember correctly. I think I've heard you say that before.
Again, I am Steve Shannon, the Executive Director of CARP, Kentucky Association of Regional Programs. It's Association 11 of the 14 community mental health centers. One, I want to start with just appreciating the work done by PPOB over many years, and House Bill 8. I define House Bill 8 as a perfect piece of legislation because there are parts we don't like and parts we do like. And we left the table not overjoyed with joy, but not feeling bitter. So we were okay with that. Again, I appreciate Representative Duplessis and you, Representative Tipton, the communication we've had around House Bill 8, the 2 sessions that it was worked on, ample communication. It was really good. And I'm going to say really quickly, I always do a shameful plug for mental health centers, but I think they're invaluable to the Commonwealth. One, the work here and the culminating subsidy that the centers receive, participating centers, about $18,882,100 annually, and that's been included in the budget prepared by Mr. Hicks, and A&R chairs both houses, so it's been there, we feel good about that, 3 years. We've got now 4 and 5 coming. It's a huge game changer for us. And what it does for the mental health centers, it allows us to continue functioning to the best of our ability as the behavioral health public safety net. That's what it does. We used to spend a lot of time on pension. I meet once a month with CEOs of mental health centers, and we talk pension every time. I have 2 daughters, and they will randomly ask me, "How's pension going, Dad?" And that's a really bad standard, in my opinion. And they get a kick out of that question, I think. But it allows us to do that. It allows the CMHCs to focus on the needs. So on behalf of the board of directors of each of the participating CMHCs and the executive team, the CEO, staff, and most significantly, the 155,000 individuals served and supported annually, whether they're family members, neighbors, classmates, coworkers, friends who access services. Thank you for that work. Thank you for the work of the General Assembly and the executive branch on that subsidy. It really has shifted our concern and allow us to refocus on those core things that make a difference. And I just can't express that enough. Couldn't bring everybody with me today to thank you, but it's really a big deal for us. 2 things we're going to talk about reporting. Obviously, you referenced it earlier. There's a regulatory reporting requirement and a statutory reporting requirement. The regulation, 105 KAR 1451, I think, tells us what to report, how to report, and when to report. I'm here to tell you we shall report specifically as directed. We understand the value of reporting. CARP Association of 11 mental health centers, 9 of the 11 participate in KRS. 1 never joined. never entered. The other 9 do, and they report. Now there's staff that reports. So this is a lot of work, and it's onerous. The leadership says, okay, we're going to report, and we shall report. We shall continue to report regardless. The online thing obviously causes some concerns because nobody likes change, but we shall report. We shall do that specifically, and we will respond to inquiries from KPPA about our reports, and we will do that in a serious manner because we understand the ramifications, the potential ramifications of the subsidy being at risk. So we shall report. The next piece is statute. KRS 61.5991, increase or maintain participation. We shall increase or maintain participation in KRS non-haz. We shall do that. We understand that as well, and we're moving in that direction right now. So, from House Bill 8 perspective, yes, we are being compliant with the requirements, and we greatly appreciate the subsidy. And the work of PPOB made that happen. And Dave Eager's not here, but I was going to express my thanks to Dave Eager. We've had many conversations with Mr. Eager, some very pleasant, and some may be categorized as something else. But he's always open, and he's always fair. You all have been open and fair every time we raised issue. For us, the ongoing concern with KRS non-haz was the escalating cost. It was capped at 49.47%. The new system with 2 separate distinct costs allow us to move forward. The employer normal cost is something we can manage, and the subsidy allows us to address the actuarially unfunded liability. And we appreciate that. I will answer any question that you have. Obviously, 7 counties as a member. I think we all know I can't answer questions about that, but the other 9 that participate, I'll gladly answer questions about them if you have specifics. And the one that did not participate is Pathways, and that's 10 counties in Northeast Kentucky, and they never joined. They never made application. The person who was, I think, the 2nd or 3rd CEO there when he got hired in the late 60s didn't believe it was necessary to join, and they never did.
Is that the end of your report?
That's all I got.
That's all you got? Okay.
We shall.
Chairman
That was my
Johnson.
charge coming here today.
Chairman Johnson.
So I'm going to ask basically the same question I asked Aaron. From your perspective, and you may want to just get back to us on this, but from your perspective, no first effort on a piece of legislation is ever 100%. If you've got some suggestions, some recommendations on how we can do things better,
Okay.
and something we may need to address legislatively, now is the time to do it while we're in the interim.
Mm-hmm.
And certainly welcome your comments.
Yeah, we'll do that.
Thank you, Mr. Chairman.
You're welcome. Any other questions? Seeing none?
That's the easiest pension conversation I've had in a long time, and I appreciate it.
Don't get used to it.
No, I know. It's all good.
Before we adjourn, I think that's everybody on the program.
Yeah, just June.
We will not have a meeting in June. Our next meeting will be in July. But I do want to mention this past session, for the last couple of years, we've had a policy in place that no retirement issues would pass through the General Assembly that wasn't first vetted in PPOB, and I think that was a good policy, and it's worked out very well. So thanks everyone who was involved in that. Thanks to the PPOB committee and the chairman who helped make that possible. So we want to thank you all very much, and it almost seems like 40-minute meeting, but we have a motion to adjourn. We are adjourned.